There's no denying the COVID-19 vaccine has proven to be highly effective, but some experts also believe natural immunity plays a critical role in preventing reinfection of severe COVID. Here's CBS 21's Ed Russo with our special report.
There are many controversies involving COVID, but there's one debate that's become very contagious, and that is the question on whether natural immunity is sufficient in preventing severe COVID reinfection.
Your immune system is arguably one of the most intricate and complex parts of your body. It's designed to naturally fight off infection, including COVID. Chris Turnpaul, clinical director of Turnpaul Health and Wellness in Mechanicsburg, believes natural immunity is underscored.
If you have natural immunity because you've had COVID, the NIH says you have durable immunity for up to 8 months, and the reason they say that is because we haven't studied it longer than 8 months.
Durable immunity meaning you have continued immunity against severe infection.
When you get the vaccine, you train your immune system to recognize the infamous COVID protein spikes, kind of like how your phone recognizes your face with Face ID. With natural immunity, your immune system doesn't just recognize the protein spikes, but the entire surface of the virus, kind of like your phone not just recognizing your face, but the entire body that it's attached to.
This is why some experts believe that natural immunity may be as or possibly more effective than vaccine-induced immunity. A Cleveland Clinic study earlier this year determined the need for vaccination of previously infected people. The study included over 50,000 of the clinic's employees. Nearly 2,600 of the employees had previous infection. In the following 5 months of the study, not one single employee got reinfected with COVID. In the conclusion of the study, the Cleveland Clinic even stated, people with previous infection are unlikely to benefit from COVID-19 vaccines. Dr. John Goldman, an infectious disease specialist at UPMC, expanded upon this statement.
So what they said was over a short period of time, it appears as though people who have had infection don't get reinfected. And in fact, we do recommend that if you've been infected with COVID, that you not get vaccinated for 90 days. And so I think one of the reasons I personally believe that a booster makes sense is we made a conscious decision, because 3,000 people a day were dying, to give as many people as much immunity as quickly as possible, and now we're trying to give them long-lasting immunity.
Dr. Goldman says we need more data to be more certain of lifelong immunity from natural infection.
And if there's a study a year from now or 5 years from now that says it's almost certain that natural infection confers lifelong immunity, I'll tell people they don't need to get a booster.
Dr. Turnpaul maintains the benefits of natural immunity should be taken more seriously.
If you have to carry a vaccine card, you should have the same level of protection if you carry your previously infected to COVID card. It's just absolute bias and discrimination against those who have suffered and survived COVID. They have the same level of protection, there's only one study that shows otherwise, as if you've gotten the COVID vaccine. The antibodies wane in the COVID vaccine. We don't know yet if they wane in natural immunity.
Besides vaccination, the CDC still champions avoidance measures, but one important suggestion seems to be oddly missing.
We have dropped the ball on get healthy, stay healthy. For people who have been vaccinated, they think that they have a get out of jail free card, but they've never addressed their own health concerns.
Is you should follow everything your mother used to tell you to do. Get enough sleep, don't eat too much, don't drink too much, eat healthy.
You can make the decision right now to become healthier. You will be better prepared to fight off infectious disease. There's certainly no debate there. Ed Russo, CBS 21 News.